Welcome to another edition of This is Public Health, a podcast from the Illinois Department of Public Health. And believe it or not, it's time for children across Illinois to head back into the classroom. So we're looking at back-to-school health issues, particularly immunization and the health benefits and legal issues connected to it. We are joined by Dr. Hillary Spencer, pediatric infectious disease physician and the infection prevention medical advisor at IDPH, and Dr. Michelle Barnes, the president of the Illinois chapter of the American Academy of Pediatrics. Thank you both so much for joining us. Dr. Spencer, I want to start with you. As parents are scrambling to get kids back to school, one of the things on their list will be those back-to-school physicals, including any required immunizations. Why are immunizations so important for each individual child, but also for the health of the broader community at large?
Ensuring immunizations are up to date for school entry is a crucial part of getting ready for the school year. Immunizations help individuals and schools avoid outbreaks of contagious vaccine-preventable diseases and optimizes the individual child's chance of healthy school attendance. Avoiding these diseases also helps the whole school. No vaccine provides complete protection, and they work best when everyone who can be vaccinated is vaccinated. Keeping diseases out of the school means all children have the opportunity to attend and learn and develop the brightest future possible.
Dr. Barnes, I want to talk about your experience as a pediatrician and share with us, if you could, some of the stories you've seen firsthand about the importance of timely vaccinations for children.
Sure. Thanks so much for having me here today to discuss this important issue. Immunizations are fundamental to public health, and we have seen the incidence of disease from many viruses and bacteria decrease significantly over the last several decades as a result of immunization programs. I'd like to touch on the importance of timely vaccination for children. So as we know, bacteria and viruses are all around us, and we don't know when we're going to encounter them while living our lives and moving about our communities. So timely vaccination, meaning that children receive their vaccines as soon as possible based on their age or the time of year for seasonal immunizations, means that their bodies will be as ready as possible when they encounter something infectious. This will help them prevent the child from developing an infection themselves, but also prevent them from spreading it to their home, school, or community. As a pediatrician, I know that some children hesitate when it comes to vaccination due to their concerns around pain and their anxiety about the vaccine itself. This is typically a child's first question when they come to my office. Am I going to get shots today? However, most children find that the anticipation is much worse than the pain that they experience, and they are surprised to learn when the vaccines are over. Most of them say it wasn't that bad. I do encourage parents not to leave the choice to vaccinate up to their children, particularly for young children, as they aren't old enough to understand the benefits of vaccination, and the brief discomfort that the child experiences brings significant health benefits. One more thing I would like to add is that during the pandemic, I had many patients, actually children, who were asking to be vaccinated. They knew that this was what they could do to do their part in curbing the pandemic, and they were thrilled to play a role in ending the pandemic that had influenced their family in so many different ways. Many of them knew this was a necessary step to help keep their loved ones, including younger siblings and their grandparents, healthy.
It's an important point you've made about the fact that immunizations are more than just the individual getting the shot, but also about the health of the broader community at large, and particularly when we're talking about schools as a congregate setting. So we do have some requirements built into the law about vaccination. Dr. Spencer, can you talk about the vaccination requirements for school children in Illinois?
The immunization requirements for children in Illinois depend on the child's age and whether they are entering daycare or preschool, kindergarten, or other older grades. If a student is up to date with CDC and AAP immunization recommendations, they should be ready for school. The specific vaccines that are required depend on the child's age and grade level. They protect against diseases like pertussis, polio, measles and mumps, chickenpox, hepatitis B, meningitis, and pneumococcal disease. Additionally, Illinois requires college students of all ages to be vaccinated against diseases including diphtheria, tetanus, pertussis, measles, mumps, and rubella, and college students under 22 years of age must be vaccinated against meningococcal disease.
Dr. Barnes, can you speak to any exemptions that are written into the law?
Sure. Illinois does allow a certificate of religious exemption for required immunization. This certificate must be signed by the child's healthcare provider, who is responsible for performing the child's examination for school entry, particularly for entry into kindergarten, 6th grade, or 9th grade. This affirms that the provider discussed with the child's parent or guardian the benefits of immunization and the health risks to the student and to the community of not immunizing. And that certificate has to be submitted to the school.
I'll also add that there are medical exemptions allowed in Illinois as well. If a child has a medical condition that prevents them from receiving a vaccine, they will not be required by the school to receive it. There are a few conditions that make it unsafe for a child to have a vaccine. A compromised immune system may make it unsafe for a child to receive a specific vaccine. However, not all immunocompromising conditions make it unsafe. And the condition may be permanent, but may also be temporary. For example, some congenital conditions are lifelong, but chemotherapy or high-dose steroids may be temporary. If a child is allergic to a vaccine component, then they will be exempt from that vaccine and other vaccines that contain that component, but not all vaccines. Every vaccine is different. And sometimes there are alternative formulations. A medical exemption needs to be signed by the clinician that is responsible for the child's health examination. There are also allowances made for students who are homeless through a federal act called McKinney-Vento. This allows children who are homeless to immediately enroll in school while documentation of their immunization records or catch-up vaccines are obtained.
And beyond those exemptions, then, for most children, there will be that requirement to have the immunizations as prescribed in the law. Dr. Spencer, what happens when children don't meet those deadlines?
Children who are not vaccinated by the deadline will be excluded from school. Vaccines should be received by the start of school, though there may be a short grace period. Illinois allows schools to set this grace period as long as it ends before October 15th. After this period, unvaccinated children without an exemption cannot attend school until they have received the required immunization and have the required documentation. If a child has received all the vaccines they can medically get before the school starts, and a healthcare provider indicates when the next doses will be given within the same school year, the child is in compliance with school requirements. However, if a scheduled appointment is missed, the child will be out of compliance and excluded from school. In the event of a vaccine-preventable disease outbreak, unvaccinated students may need to be excluded from school for a certain period. Whether a student needs to be sent home and for how long depends on the disease. For example, during a measles outbreak, those unvaccinated students must get vaccinated within 72 hours of exposure or be excluded from school for 21 days after the onset of the most recent case.
You're listening to This is Public Health with the Illinois Department of Public Health. Our guest, Dr. Hillary Spencer. She's the Infection Prevention Medical Advisor at IDPH, and Dr. Michelle Barnes, President of the Illinois chapter of the American Academy of Pediatrics. Dr. Barnes, you talked about earlier the fact that some children were very eager to get the COVID vaccine, for example, to do their part to prevent the spread. But we also know that we have seen across society a rise in vaccine hesitancy in recent years, and a phenomenon that we really saw pick up during COVID. How do you reassure people about the safety and effectiveness of vaccines?
Well, Jim, that's a great question. And I think a lot of how I reassure my patients is through the relationships that I have with them and that we've built over the many, many years that I've been caring for their children. And so that's why I think for people who have hesitancy around vaccines, talking with their primary care provider or their pediatrician in my case is a really excellent resource and an excellent opportunity to kind of try to help address any concerns or questions that they might. That said, generally, I let my patients know that vaccinations are very well studied by researchers around the world and reviewed extensively by experts in the field by the Centers for Disease Control or the CDC. These vaccinations are studied for safety as well as for efficacy in large populations of individuals of all ages and are only recommended after thorough review.
Dr. Spencer, conversely, there are risks involved with not being vaccinated. Can you talk about some of the risks there when children do not receive these timely immunizations?
Sure. The risks are different for every disease that is prevented by a vaccine. We usually think about the personal risks of the disease, but there are also risks to other students. And then there's also the risk of needing to be excluded from school if there's an exposure. Let's take measles, for example. Measles is one of the most contagious diseases, and it's preventable by vaccine. Measles itself causes high fevers, runny, watery eyes, cough, and a rash. It can cause pneumonia in 1 out of every 20 children, and 1 in 5 children with measles may be hospitalized. Even more severely, in 1 in 1,000 children, they develop encephalitis, which is a swelling of the brain. Some children who get the disease may even die from complications. Those are the risks of the disease itself. If a student is unvaccinated and gets measles, that also puts their classmates at risk of getting measles. They may have classmates who are unvaccinated for health reasons or other exemptions that we've talked about before. For every 10 people who are exposed to measles who don't have protection from the vaccine or previous disease, 9 will get the disease. Being unvaccinated also means that a student may need to be excluded from school if they were exposed to measles at school or somewhere else. Lost school days can make it difficult for kids to catch up to their peers.
We have focused a lot on the very important issue of immunizations, but that back-to-school physical involves more than just getting caught up on shots. Dr. Barnes, what else goes into that back-to-school physical, and why is that so important?
That's a great question, Jim. And I think it's one that we like to remind our patients about every year because there's a lot more that we do in the pediatrician's office besides just providing immunizations, which are fundamental, but it's not the only thing that we do. So at each of our back to school physical examinations, we use this time to check in with the child and their family to see how they're doing in terms of their physical health and their emotional. We discuss things like their diet, their growth, and we make sure that they're developing well physically and socially. And if they're not, and if there are concerns, we can provide resources to patients and families to help them get needed services to address any concerns that we see or that they have. In addition, we provide a safe space for children to ask about their own physical health. And particularly as they get older, we really encourage them to have questions about their health and to see their provider as somebody that they can ask those questions to. We offer a lot of guidance to our families and to children specifically about what they can expect in the coming years or months between now and our next visit. And we discuss a lot of different ways that they can help prevent injury at each developmental stage. So whether they're a toddler, a school-age child, or a teenager, we discuss injury prevention along many different lines, including bike helmets, seatbelts, and things like that to help keep our children safe.
We know that in some parts of the state, it can be harder to find a provider, and some families are lacking what's known as a medical home. Dr. Spencer, what resources are available to help children and families get these essential checkups and immunizations?
Insured families should check to see which providers are in network with their insurance plans to minimize costs. Some children may be eligible for the Vaccines for Children program, referred to as VFC. Children eligible for VFC include those who are enrolled in Medicaid and those who are uninsured, those whose insurance doesn't cover vaccines, and those who are American Indian or Alaskan Native. If a child is enrolled in Medicaid, their parent or guardian can contact their Medicaid managed care plan to determine who their child's provider is. Families may also contact their local health departments to determine if they are eligible to get vaccines at the health department or to get more information. Sometimes schools will be able to provide lists of providers in the area or upcoming health fairs, and some schools have school health clinics. This is also a good time to point out that pharmacists in Illinois can vaccinate children that are 7 years and older. For flu and COVID, pharmacists can vaccinate children as young as 3. Families should ask their pharmacist if they carry vaccines and whether their insurance will cover them at the pharmacy.
A lot of good information here today, and there's a lot more we can tell parents and families about this. So I'd like to perhaps refer them to some additional resources. Dr. Barnes, where can people go to learn more about keeping their children safe and healthy as they head back to school?
First, I always recommend that people refer to their medical home or going to their pediatrician or their primary provider to ask these types of questions as they're planning to go back to school. Like I said, we really hope to be a trusted source of information for the children and families that we care for, and it is always our goal to help parents raise happy and healthy and thriving children. That said, we recognize that you may not get the answers that you need as quickly as you need them by calling your pediatrician's office. Therefore, the American Academy of Pediatrics has excellent resources for families, particularly at our website, healthychildren.org. This website is an excellent resource that provides free and accessible information for families on each stage of a child's life, including information about immunizations, healthy eating, and various physical conditions that a child might experience. Again, this is a trusted source of information that's developed by experts, and it's created for parents and guardians and written in a way that most people hopefully can understand. One last thing, they're also recommended to go to our social media website for the Illinois chapter of the American Academy of Pediatrics. We have a lot of information also relevant to our local communities here in Illinois.
And give us that web address one more time, if you would.
Oh, sure. Healthychildren.org.
Great. We'll have a link there in the notes section that goes along with this podcast and links to other services as well, including that Vaccines for Children program, federally qualified health centers, local health departments, a lot of different ways that parents can get this information that will help them have healthier children and healthier families. In the meantime, we want to thank you both for being here. Dr. Hillary Spencer, pediatric infectious disease physician and infection prevention medical advisor at IDPH. And Dr. Michelle Barnes, the president of the Illinois chapter of the American Academy of Pediatrics. Thank you both so much for this important information. We greatly appreciate your time.
Thank you, and we're wishing all the kids a happy, healthy start to the new school year.
Indeed. Join us next time for another edition of This is Public Health with the